Question 1. Topic: Air security and cybersecurity measures. Hospital recently implemented an updated electronic health record (AIR) system. During routine audit, it was discovered that multiple staff members were using shared login credentials to access patient records for efficiency. What is the most significant compliance risk associated with this practice? A. It violates the principle of role-based access control (RBAC), leading to excessive access privileges. B. It increases the risk of security breaches and violates HIPAA's security rule regarding unique user identification. C. It causes billing errors due to misattribution of actions within the AIR. D. It only affects internal hospital workflows and does not pose significant external compliance risks. Answer: B. It increases the risk of security breaches and violates HIPAA's security rule regarding unique user identification. Explanation: under the HIPAA security rule 45 CER S 164.312a2, covered entities must implement unique user identification to track individual access to electronic protected health information (FI). The use of shared credentials increases the of unauthorized access, weakens audit trail integrity, and makes it impossible to determine accountability for data breaches. Additionally, National Institute of Standards and Technology (NIST) SB 80063 outlines best practices for authentication, which discourage shared logins. Option is incorrect because while role-based access control (RBAC) is best practice, the primary compliance violation here is the lack of unique user identification. Option C is incorrect because billing errors, while possible, are secondary to the primary legal and security risks. Option D is incorrect because HIPAA violations have significant legal consequences, including potential fines and audits from the Office for Civil Rights (OSA). Question 2. Scenario-based. Topic: Release of information. ROI and HIPAA compliance. Dr. Collins, primary care physician, receives an urgent call from pharmaceutical company conducting research study on chronic diseases. The representative requests access to identified patient data for their study, stating that their organization follows strict confidentiality guidelines. Dr. Collins is uncertain whether sharing this data is permissible. Should he do in this situation? A. Provide the identified data immediately, as HIPAA does not regulate identified patient information. B. Deny the request entirely, as sharing any patient-related data violates HIPAA, even if de-identified. C. Ensure that the data is properly de-identified using HIPAA-approved methods and verify that the company qualifies for data use agreement (DUA) before releasing it. D. Share only the names and medical conditions of the patient, ensuring no financial or social security details are included. Answer: C. Ensure that the data is properly de-identified using HIPAA-approved methods and verify that the company qualifies for a data use agreement (DUA) before releasing it. Explanation: HIPAA allows the use and disclosure of de-identified health information without patient authorization, but only if the data is properly de-identified using one of two methods outlined in 45 CFRS 164.514a. B. Safe harbor method, removing 18 specific identifiers, including names, geographic data smaller than A, state, and medical record numbers. Expert determination. Qualified expert confirms the data cannot reasonably be re-identified. Additionally, when sharing data for research, data use agreement (DUA) should be in place to outline restrictions on data usage and ensure compliance with HIPAA and the Common Rule 45 CFRS 46.116 for human subject research. Option is incorrect because de-identification must follow strict guidelines and not all methods meet HIPAA standards. Option B is incorrect because HIPAA allows sharing de-identified data when appropriate protocols are followed. Option D is incorrect because sharing names violates HIPAA's protected health information (FI) provisions, even if medical conditions are included without other identifiers. Question 3. Topic: Medical billing, coding, and reimbursement. Hospitals' revenue cycle team notices that claims for telehealth visits are frequently being denied by insurance companies. Upon investigation, they find that the issues related to incorrect use of place of service POS codes and modifiers in the AIR system. Which of the following actions is the best approach to ensure proper reimbursement for telehealth services? A. Use POS code 11 Office for all telehealth visits as it is the default for most outpatient encounters. B. Verify each payer's telehealth reimbursement policies and ensure proper use of POS codes 2 or 10 and appropriate modifiers GT 95 for claims. C. Resubmit all denied claims without making any changes, as insurance companies often reconsider claims upon appeal. D. Manually adjust the diagnosis codes in the AIR system to match those that typically receive reimbursement. Answer. B. Verify each payer's telehealth reimbursement policies and ensure proper use of POS codes 2 or 10 and appropriate modifiers GT95 for claims. Explanation. Telehealth reimbursement is governed by Medicare, Medicaid, and private insurers, each of which has specific guidelines. According to CMS, Centers for Medicare and Medicaid Services, correct reimbursement for telehealth services requires proper POS codes. POS 2, telehealth provided other than in patient's home. POS 10, telehealth provided in patient's home. Correct telehealth modifiers. Modifier 95, synchronous telemedicine service. Modifier GT, telehealth services via interactive audio and video telecommunications. By ensuring the correct codes and modifiers are used, claims can be processed correctly without unnecessary denials. Option is incorrect because POS 11, office, is meant for in-person visits and can lead to claim denials when used for telehealth. Option C is incorrect because resubmitting claims without correcting the errors will likely result in continued denials. Option D is incorrect because modifying diagnosis codes to increase reimbursement could be considered fraudulent billing under the False Claims Act 31 U.S.C. SSS 3729, 3733 and lead to legal consequences. Question 4. Health information management and data standards. In an effort to improve interoperability and ensure that patient data is seamlessly shared between healthcare providers, the federal government has implemented various data standards, including HL and FH. However, many healthcare organizations still struggle with integrating these standards into their existing AIR systems due to legacy software and data inconsistency. Which of the following describes the primary challenge that healthcare facilities face in achieving full interoperability using HL and FH? A. The lack of a unified coding system across all AIR vendors prevents accurate data translation. B. HL and FH require extensive manual data entry, which increases the risk of human error. C. The high costs associated with upgrading legacy systems and ensuring compliance with evolving standards. D. FH and HL standards are not legally recognized and, therefore, not widely adopted in the healthcare industry. Answer. C. The high costs associated with upgrading legacy systems and ensuring compliance with evolving standards. Explanation. One of the biggest challenges in interoperability is the high cost of upgrading legacy AIR systems to support HL and FH standards. Many healthcare providers still operate outdated systems that were not designed for seamless data exchange, leading to significant expenses in software updates, staff training, and compliance. Adjustments. Option is incorrect because standardized coding systems like ICD-10 and SNOMED help facilitate data translation across AIRs. While some inconsistencies exist, this is not the primary challenge. Option B is incorrect because HL and FH are designed to reduce manual data entry by automating data sharing. Option D is incorrect because both HL and FH are widely recognized and promoted by the Office of the National Coordinator for Health Information Technology, ONC. Question 5. AIR security and cybersecurity measures. Scenario-based. Sarah, an AIR specialist at a large hospital, notices unusual login attempts on the system from a remote location outside the hospital network. Upon further investigation, she realizes that a physician's account has been compromised and unauthorized individuals have accessed patient records. Sarah immediately reports the issue to its security team. What is the best of action for Sarah and the hospital's its security team to take next in accordance with HIPAA regulations? A. Ignore the login attempt since the physician may have accessed the system remotely for patient care. B. Temporarily suspend the compromised physician's access, investigate the breach, and notify affected patients if necessary. C. Reset all hospital staff passwords immediately and enforce two-factor authentication for all future logins. D. Request that the physician change their password and document the event without further action. Answer. B. Temporarily suspend the compromised physician's access, investigate the breach, and notify affected patients if necessary. Explanation. Under HIPAA Security Rule 45 CIS 164.308, they and 2 healthcare organizations must have an incident response plan to mitigate security breaches. The hospital must immediately suspend the compromised account to prevent further unauthorized acts, conduct an internal investigation, and, if necessary, notify patients affected by the breach under the HIPAA Breach Notification Rule 45 over SS 164.400.414. Option is incorrect because failing to act on potential breach can lead to non-compliance and legal penalties. Option C is partially correct but overly broad. Resetting all passwords may not be necessary unless the breach is widespread. Option D is incorrect because simply requesting password reset does not address the severity of the security breach. Question 6. Medical billing, coding, and reimbursement. The patient visits a primary care physician and undergoes a routine physical examination. During the visit, the physician also diagnoses the patient with hypertension and prescribes medication. However, when the medical bill is processed, the insurance company denies payment for the physical examination, stating that it should not be billed alongside a diagnosis-based visit. What could be the most reason for the claim denial? A. The physician incorrectly coded the visit using evaluation and management. M. Codes without proper modifier usage. B. The insurance company does not cover physical examinations under any circumstance. C. The claim was submitted too soon after the patient's previous visit, leading to an automatic denial. D. The physician did not obtain prior authorization from the insurance company for the examination. Answer A. The physician incorrectly coded the visit using evaluation and management. M. Codes without proper modifier usage. Explanation. In medical billing, evaluation, and management, M. Services often require a modifier e.g. modifier 25 when a preventive service e.g. physical exam is performed on the same day as a separately identifiable problem-oriented visit. If the modifier is missing, the insurer made claim assuming the services were duplicative. Option B is incorrect because most insurance plans cover routine physical exams, though billing them with diagnostic visits requires proper coding. Option C is incorrect because claim denials due to frequency restrictions usually apply to specialized procedures, not standard checkups. Option D is incorrect because physical exams typically do not require prior authorization unless specified by the insurance policy. Question 7. Telehealth and AI integration. With the rise of telehealth services, healthcare providers must ensure that their AI systems support secure remote consultations and documentation. What is the most critical requirement for ensuring compliance with HIPAA and other federal regulations when conducting telehealth visits? A. Using end-to-end encrypted video conferencing platforms for virtual consultations. B. Keeping all telehealth session notes separate from the patient's main AI records. C. Restricting telehealth services only to patients who have previously visited the provider in person. D. Allowing patients to access their telehealth visit notes only upon formal written request. Answer A. Using end-to-end encrypted video conferencing platforms for virtual consultations. Explanation. Under HIPAA privacy and security rules 45 CFR Parts 160 and 164, telehealth providers must use secure, encrypted platforms to protect protected health information during virtual visits. End-to-end encryption ensures that only authorized parties can access the communication, reducing the risk of data breaches. Option B is incorrect because telehealth records should be integrated into the patient's AI for continuity of care. Option C is incorrect because many telehealth services do not require prior in-person visits. Option D is incorrect because under HIPAA's right of access provisions, patients should have direct access to their records without requiring a formal written request. Question 8. Quality improvement and reporting. The merit-based incentive payment system MIPS is designed to improve healthcare quality by tying physician reimbursements to performance metrics. Which of the following best describes a key component of MIPS? A. Physicians are only evaluated based on patient satisfaction scores. B. Participation in MIPS is voluntary for all healthcare providers. C. MIPS measures include quality, cost, improvement activities, and promoting interoperability. D. Providers who fail MIPS evaluations are permanently banned from Medicare reimbursement. Answer. C. MIPS measures include quality, cost, improvement activities, and promoting interoperability. Explanation. MIPS under MACRA, Medicare Access and CHIP Reauthorization Act of 2015 evaluates healthcare providers based on 4 key performance categories: quality e.g. patient outcomes, best practices; cost e.g. efficiency and resource use; improvement activities e.g. patient engagement initiatives; interoperability e.g. usage and secure data sharing. Option is incorrect because patient satisfaction is just one aspect of quality assessment, not the sole factor. Option B is incorrect because MIPS is mandatory for most Medicare providers. Option D is incorrect because poor performance results in payment adjustments, not permanent exclusion from Medicare reimbursement. Question 9. HIPAA compliance and patient privacy. Scenario-based. Emma is an AS specialist at a large healthcare clinic. One day, a receptionist asks her for login credentials to access the AS system since their account is temporarily locked. Emma knows the receptionist needs to check a patient's insurance details but is aware that sharing login credentials is against policy. What is the most appropriate action Emma should take in this situation? A. Provide her login credentials to the receptionist for temporary access to avoid workflow disruptions. B. Ask supervisor for permission before sharing her credentials. C. Deny the request and instruct the receptionist to contact it to resolve the issue. D. Allow the receptionist to use her workstation under supervision to complete the task. Answer: C. Deny the request and instruct the receptionist to contact it to resolve the issue. Explanation: HIPAA Security Rule 45 CFR S 164.312a 2 requires unique user authentication for accessing electronic protected health information (FI). Sharing login credentials violates this requirement and can lead to unauthorized access. Option is incorrect because sharing credentials can result in HIPAA violations and security breaches. Option B is incorrect because even supervisor cannot authorize credential sharing under HIPAA guidelines. Option D is incorrect because allowing another person to use workstation under someone else's login still constitutes violation. Question 10. AS system implementation and data migration. A hospital is transitioning from an outdated AS system to a new cloud-based system. The team is responsible for migrating patient records and ensuring data integrity. Which of the following is the most important step in ensuring a successful data migration? A. Transferring all data at once to minimize downtime. B. Mapping and validating data to ensure accurate field transfers. C. Deleting redundant records to reduce data storage needs. D. Relying on vendor-provided migration tools without additional verification. Answer: B. Mapping and validating data to ensure accurate field transfers. Explanation: data mapping ensures the information from the old AIR correctly aligns with fields in the new system. Validation processes, such as test migrations and accuracy checks, help prevent data loss or corruption. Option is incorrect because a phased approach reduces the risk of errors and downtime. Option C is incorrect because deleting records without careful review could result in the loss of critical patient information. Option D is incorrect because vendor tools alone may not catch inconsistencies or errors in the migration process. Question 11. Meaningful use and AIR incentive programs. The HITECH Act introduced meaningful use requirements to promote AIR adoption. Which of the following best describes a Stage 2 meaningful use objective? A. Implementing a complete AIR system without requiring interoperability. B. Expanding electronic health information exchange and patient access to records. C. Using only paper-based records for privacy protection. D. Allowing physicians to opt out of electronic prescribing requirements. Answer: B. Expanding electronic health information exchange and patient access to records. Explanation: Stage 2 of meaningful use focused on increasing interoperability and patient engagement by enhancing health information exchange for better coordination of care, providing patients with electronic access to their health records, expanding the use of secure messaging for communication between patients and providers. Option is incorrect because interoperability is required for MU compliance. Option C is incorrect because AIR adoption is encouraged over paper-based systems. Option D is incorrect because electronic prescribing is a key component of MU requirements. Question 12. Patient access to medical records under the HIPAA Privacy Rule 45 CRS 164.524. Patients have the right to access their medical records. However, hospital denies patients' request, stating that providing records would be too costly. Which of the following best describes the hospital's compliance status? A. The hospital is violating HIPAA by denying access based on cost. B. The hospital is correct because cost concerns override HIPAA requirements. C. The hospital may deny access only if the records contain sensitive information. D. The hospital is required to provide access only if the patient is insured. Answer: A. The hospital is violating HIPAA by denying access based on cost. Explanation: Under HIPAA, healthcare providers must provide patients access to their medical records, even if retrieval and copying are costly. While providers can charge reasonable fees, they cannot deny access solely due to cost. Option B is incorrect because financial burden does not exempt compliance. Option C is incorrect because HIPAA allows limited denials only for specific reasons, e.g., psychotherapy notes. Option D is incorrect because access rights are not limited to insured patients. Question 13. Audit trails and data security. Scenario-based. A healthcare facility suspects unauthorized access to a high-profile patient's medical records. To investigate, the team reviews the audit trail in the AIR system. What information can an audit trail provide to identify potential security breaches? A. The number of patients seen daily by physician. B. Record of who accessed patient data, when and what actions were taken. C. Only the most recent login attempts to the AIR system. D. Anonymized data on overall system usage trends. Answer. B. A record of who accessed patient data, when and what actions were taken. Explanation. Audit trails track user activity within the AIR system, including login attempts, successful and failed, access patient records and timestamps, modifications made to records, e.g. edits, deletions. Option is incorrect because audit trails do not track patient volume. Option C is incorrect because they log historical activity, not just recent logins. Option D is incorrect because they track specific user actions, not just overall trends. Question 14. Clinical Decision Support System. CS. A physician is reviewing a patient's medication list in the AIR when a Clinical Decision Support System (CSS) alert warns of a potential drug interaction. Which of the following best describes a key benefit of CSS? A. Automatically prescribing medication without physician approval. B. Identifying potential drug interactions and contraindications to enhance patient safety. C. Replacing physicians in making medical decisions. D. Allowing physicians to override alerts without documentation. Answer. B. Identifying potential drug interactions and contraindications to enhance patient safety. Explanation. CSS tools help reduce medication errors by alerting providers to adverse drug interactions, allergies, and contraindications. Option is incorrect because CSS does not prescribe drugs autonomously. Option C is incorrect because CSS supports, not replaces, clinical judgment. Option D is incorrect because overriding alerts typically requires justification. Question 15. Electronic prescribing. Under the Medicare e-prescribing program, what is a key requirement for electronic prescribing compliance? A. Prescriptions must be sent electronically using certified AIR systems. B. Paper prescriptions are mandatory for controlled substances. C. is optional for all providers and not incentivized. D. Patients must manually sign all electronic prescriptions. Answer A. Prescriptions must be sent electronically using certified AIR systems. Explanation. E-prescribing reduces medication errors and improves efficiency. Under the Medicare e-prescribing incentive program, providers must use certified AIR systems to ensure compliance and eligibility for reimbursement incentives. Option B is incorrect because many states allow electronic controlled substance prescriptions. Option C is incorrect because is encouraged and incentivized. Option D is incorrect because manual signatures are not required for electronic prescriptions. Question 16. AIR system downtime and contingency planning. Scenario-based. A hospital's AIR system experiences an unexpected system-wide outage due to cyber attack. The department estimates it will take 24 hours to restore access. Which of the following is the best course of action for maintaining patient care during the outage? A. Stop all patient care activities until the AIR system is restored. B. Use pre-established downtime procedures, including paper-based documentation. C. Contact patients to reschedule appointments until the system is back online. D. Attempt to manually input data into the AIR as soon as possible despite system instability. Answer. B. Use pre-established downtime procedures, including paper-based documentation. Explanation. Hospitals must have a contingency plan in place for AIR downtime per HIPAA regulations. Downtime procedures should include paper documentation for clinical notes, orders, and prescriptions, manual patient check-in and consent processes, offline backup access to critical patient information. Option is incorrect because patient care must continue. Option C is incorrect because rescheduling all appointments would disrupt essential treatments. Option D is incorrect because using an unstable system can lead to data corruption. Question 17. Interoperability and health information exchange. Hi, which of the following best defines interoperability in electronic health records? A. The ability of different air systems to exchange, interpret, and use health data seamlessly. B. The process of limiting access to health records for privacy reasons. C. The exclusive use of one vendor's air system across all healthcare facilities. D. Legal requirement for all providers to use the same air platform. Answer A. The ability of different air systems to exchange, interpret, and use health data seamlessly. Explanation. Interoperability ensures that air systems from different vendors can communicate effectively. It improves care coordination, efficiency, and patient safety. Option B is incorrect because interoperability promotes data sharing, not restriction. Option C is incorrect because healthcare organizations can use different vendors. Option D is incorrect because providers are not legally required to use the same system. Question 18. Clinical documentation and air accuracy. Scenario-based. A nurse enters a patient's allergy information into the air but accidentally misspells medication name, leading to incorrect documentation. What is the best way to correct the error? A. Delete the entry and re-enter the correct information without leaving record of the mistake. B. Use the errors amendment feature to correct the error while maintaining an audit trail. C. Leave the incorrect information in the system and verbally inform the physician. D. Print corrected version of the patient's record for manual updates. Answer B. Use the errors amendment feature to correct the error while maintaining an audit trail. Explanation. AS systems require that all changes be logged for compliance and security. The amendment feature ensures error correction without data deletion, complete audit trail for accountability, compliance with HIPAA and meaningful use regulations. Option is incorrect because deleting records violates HIPAA requirements. Option C is incorrect because verbal communication alone is insufficient. Option D is incorrect because printed records do not maintain digital integrity. Question 19. Cybersecurity and AI protection. Scenario-based, a healthcare worker receives an email from an unknown sender asking them to verify their air login credentials. Which of the following is the best response? A. Reply to confirm the request before sharing credentials. B. Click the link in the email to verify the authenticity of the request. C. Ignore the email and assume it is not a real threat. D. Report the email to it as a potential phishing attempt. Answer. D. Report the email to it as a potential phishing attempt. Explanation. Phishing is a common cybersecurity threat where attackers try to steal credentials. Best practices include never sharing login credentials via email, verifying requests with its security teams, reporting suspicious emails immediately. Option is incorrect because confirming before sharing still risks data exposure. Option B is incorrect because clicking the link could install malware. Option C is incorrect because ignoring the email without reporting allows further attempts. Question 20. AI customization and workflow efficiency. A clinic wants to customize its AI system to improve workflow efficiency. Which customization feature would provide the greatest benefit for physicians during patient visits? A. Pre-populated clinical templates for common conditions. B. Restricting access to all but a few staff members. C. Reducing the amount of structured data to make the system simpler. D. Replacing automated alerts with manual documentation. Answer A. Pre-populated clinical templates for common conditions. Explanation. Clinical templates speed up documentation by standardizing patient encounters for frequently treated conditions. Option B is incorrect because restricting access could delay care. Option C is incorrect because structured data ensures consistency and interoperability. Option D is incorrect because automated alerts help prevent errors and improve patient safety. Question 21. A. Usability and physician burnout. Scenario-based. Dr. Patel finds that using the air takes too much time, leading to burnout and frustration. What air feature would best help reduce his workload? A. Implementing voice recognition and dictation tools. B. Removing all documentation requirements for physicians. C. Requiring only handwritten notes to supplement air entries. D. Disabling patient portal messaging to reduce physician communication burden. Answer A. Implementing voice recognition and dictation tools. Explanation. Voice-to-text tools allow faster documentation and reduce typing fatigue. Option B is incorrect because documentation is essential for legal and clinical purposes. Option C is incorrect because handwritten notes are harder to track and retrieve. Option D is incorrect because patient portal communication improves engagement and efficiency. Question 22. Telemedicine and AI integration. A rural clinic implements telemedicine services for remote consultations. Which AI feature is most critical for telemedicine success? A. Secure video conferencing and remote access to patient records. B. Restricting telemedicine access to in-person visits only. C. Printing telemedicine notes for manual entry into the AI. D. Eliminating electronic documentation for virtual visits. Answer A. Secure video conferencing and remote access to patient records. Explanation. AI integration for telemedicine requires real-time video conferencing for consultations, remote AI access for documentation, secure data transmission to protect patient information. Option B is incorrect because telemedicine is meant for remote care. Option C is incorrect because manual entry increases errors. Option D is incorrect because documentation is essential. Question 23. Patient engagement and AI portals. What is a primary benefit of patient portals in AI systems? A. Allowing patients to access test results, request refills, and communicate with providers. B. Replacing the need for in-person visits. C. Restricting access to prevent HIPAA violations. D. Allowing providers to document patient information without patient involvement. Answer A. Allowing patients to access test results, request refills, and communicate with providers. Explanation. Patient portals enhance engagement and self-management by providing online appointment scheduling, prescription refill requests, secure messaging with providers. Option B is incorrect because portals supplement but do not replace visits. Option C is incorrect because portals are designed for secure patient access. Option D is incorrect because portals promote patient participation. Question 24. AI access and role-based permissions. Scenario-based. A hospital has implemented role-based access control (RBAC) for its AI system. A medical assistant tries to access a patient's complete medical history but receives an error message stating access denied, insufficient privileges. What is the most likely reason for this restriction? A. The medical assistant's role does not allow access to full patient records. B. The AI system is malfunctioning and needs troubleshooting. C. The patient has chosen to block certain healthcare workers from viewing their records. D. The medical assistant forgot their password, triggering security lockout. Answer A. The medical assistant's role does not allow access to full patient records. Explanation. Role-based access control (RBAC) ensures that users only access data necessary for their job to protect patient privacy and comply with HIPAA. Medical assistants may access vital signs and intake notes. Nurses may access progress notes and medication lists. Doctors may access full patient history. Option B is incorrect because system malfunctions do not selectively block access. Option C is incorrect because patients cannot selectively block staff within the facility's policy. Option D is incorrect because an incorrect password would prevent all access, not limit it. Question 25. Data integrity and duplicate patient records. Scenario-based. A hospital's AI system has flagged two different patient records that share the same name and date of birth, but with different addresses. What should the health information specialist do first to determine if this is a duplicate record? A. Merge the two records immediately to prevent confusion. B. Compare additional patient identifiers, such as social security number or medical record number. C. Delete the record with the least information to reduce clutter. D. Assume the records belong to two different patients and take no action. Answer. B. Compare additional patient identifiers, such as social security number or medical record number. Explanation. Duplicate records can lead to medication errors, incorrect billing, and patient safety risks. Best practice includes verifying multiple identifiers, SSRN, address, contact info, checking with the patient or provider for clarification, using AI deduplication tools to merge records safely. Option is incorrect because merging records without verification can lead to medical errors. Option C is incorrect because deleting data violates record-keeping policies. Option D is incorrect because ignoring potential duplicates risks patient safety. Question 26. AI audit trails and compliance. Scenario-based. An audit reveals that a staff member accessed the celebrity's AI record without authorization. The hospital's compliance officer must take immediate action. What is the most appropriate response to this breach? A. Review the audit trail logs, confirm unauthorized access, and report the violation. B. Ignore the incident unless the patient files complaint. C. Assume the staff member had legitimate reason and take no action. D. Notify the media to maintain hospital transparency. Answer A. Review the audit trail logs, confirm unauthorized access, and report the violation. Explanation. HIPAA requires audit trails to track air access. Unauthorized access is a HIPAA violation and should be reported immediately. Option B is incorrect because hospitals must proactively enforce compliance. Option C is incorrect because assumptions should not replace investigation. Option D is incorrect because patient privacy laws prohibit disclosing FI to the media. Question 27. AIR system implementation and training. Scenario-based, a clinic is transitioning from a paper-based system to an AIR system. Staff members are struggling with the new software and frequently make documentation errors. Which strategy would be most effective in improving staff adaptation to the AIR system? A. Implement ongoing AIR training sessions with hands-on practice. B. Allow staff to continue using paper charts indefinitely. C. Restrict AIR use to doctors only and require all other staff to record notes manually. D. Install security cameras to monitor staff performance. Answer A. Implement ongoing AIR training sessions with hands-on practice. Explanation. A structured AIR training program should include hands-on practice to improve familiarity, role-based training to address different staff needs, live support to assist with real-time issues. Option B is incorrect because continuing paper records delays the transition. Option C is incorrect because all staff members should use the AIR system. Option D is incorrect because monitoring does not improve understanding. Question 28. HIPAA privacy and patient consent. Scenario-based, a patient inquires about who has accessed their AIR record over the past year. What should the AIR specialist do to comply with HIPAA regulations? A. Provide an access log report detailing who viewed the record. B. Refuse the request as patients cannot see access logs. C. Require a subpoena before releasing access records. D. Direct the patient to its security for further investigation. Answer A. Provide an access log report detailing who viewed the record. Explanation. HIPAA gives patients the right to request an access log showing who accessed their medical records, when and why the records were accessed. Option B is incorrect because HIPAA grants patients this right. Option C is incorrect because a subpoena is not required. Option D is incorrect because the AIR specialist is responsible for providing access logs. Question 29. AIR data backup and disaster recovery. Scenario-based, a healthcare facility experiences a server crash leading to temporary AIR inaccessibility. What is the best course of action to ensure data recovery? A. Restore patient data from encrypted backup servers. B. Re-enter patient data manually from memory. C. Wait for the system to come back online without taking further action. D. Reinstall the AIR system and delete all data to start fresh. Answer A. Restore patient data from encrypted backup servers. Explanation. AIR disaster recovery plans should include regular encrypted backups to prevent data loss, redundant systems for emergency access, recovery testing to ensure backup integrity. Option B is incorrect because manual data re-entry increases errors. Option C is incorrect because waiting without a plan delays patient care. Option D is incorrect because deleting old data violates compliance regulations. Question 30. E-prescribing and medication safety. Scenario-based, a physician electronically prescribes a high-risk medication, but the AIR alerts that it may interact with another drug the patient is taking. What should the physician do before proceeding with the prescription? A. Review the interaction alert and modify the prescription if necessary. B. Ignore the alert and continue with the prescription. C. Disable all medication alerts to streamline workflow. D. Call the pharmacy to override the AIR system. Answer A. Review the interaction alert and modify the prescription if necessary. Explanation. AIR systems help prevent medication errors by flagging dangerous drug interactions, providing alternative medication options, ensuring patient safety before prescription approval. Option B is incorrect because ignoring alerts risks patient harm. Option C is incorrect because alerts improve medication safety. Option D is incorrect because pharmacies rely on accurate AIR prescriptions.